My talk was on new models of interaction between patients and the care team. And I think it's time to change the way how we communicate with our patients. That was only also, I think, a real need in when COVID came up, the COVID pandemic, because many patients were no longer able to come directly to the clinic because the clinics wanted to be COVID-free as much as possible. So we had to start with telephone conversations, and what is, of course, more advanced is Zoom conferences, tele consultations. So the new modes of interaction will be adapted, I think, in many places, particularly for people and patients who live far away from the treatment center. But that is only the technical aspect. The qualitative aspect is that patients need to have, patients with serious diseases benefit when they have immediate access to their care center and report their quality of life, their well-being, their symptoms, particularly when something is changing, when they experience severe symptoms like whatever, night sweats or fever or fatigue. They should be able to communicate directly with the care center and the care team. And there are now computer programs which enable the care team to distinguish whether any information which has been sent by the patient is alerting and requires immediate interaction, or whether that can wait for a day, or whether the question from the patients can be answered within the next couple of days. So the benefit lies in particularly in let's say, in the reduction of any time delay if the situation of the patient is changing, and allowing the care team to recognize that there's a critical situation, the patient is in a critical situation, and to react accordingly. I mentioned some examples: infections, hypercalcemia, paraplegia, whatever the symptoms may look like. And they need immediate attention and immediate interaction. And that is provided by these, what we call patient-reported outcome measures, which are supported by electronic devices. And so communication can be in real time if needed. There are many benefits for the patients, because it has been shown that when these electronic devices are implemented and patients have access to these devices, you can thereby reduce the visits to the emergency room, hospitalizations. You can improve the adherence of patients to therapy. Patients are empowered, and there are also many benefits for the care team, because the care team benefits from understanding what's going on. The care team receives, for instance, quality of life assessments immediately, on time and structured, and they can follow these symptom scale over long periods of individual patients. And that improves the quality of documentation. It enhances and improves the symptom capture during clinical studies. And in the end, when you implement such systems, you may even improve survival of your patients, and that has been shown, for instance, in patients with solid tumors, lung cancer. So there are many benefits associated with these patient-reported outcome measures, which are based on an electronic interaction between patients and the care team. And There are some, of course, challenges as well, because it may be difficult for some patients, for elderly patients, to use these electronic devices. And the care team has to prepare, of course, and has to adapt, because there has to be somebody available all time, be on duty to respond to emergency requests from the patient. So it is maybe challenging to establish the structure in the care team, but in the end, both parties, namely particularly patients and the care team, are the winners of such electronic communication devices. And that was my point during my presentation.